My name is Megan Fink, and today I'm going to be presenting the information I have compiled on my infographic about coronary artery disease and reducing your risk of death, particularly in the population of those 35 years of age and older. So first, let's talk a little bit about what coronary artery disease is. Basically, it's the buildup of fatty deposits or plaque on the blood vessels that supply the heart, preventing blood flow, which reduces the amount of oxygen the heart receives. Those blood vessels are called coronary arteries. So why would this be important? Well, when we look at the numbers, 1 out of every 4 deaths in the United States is from cardiovascular disease, which translates into 1 death every 36 seconds. And under that umbrella, there is a heart attack every 40 seconds. The really scary part about those heart attacks is 1 in every 5 person who has a heart attack doesn't even know it happened. So when we look at the general population for coronary artery disease and cardiovascular disease, 88 per 100,000 people in the United States has cardiovascular disease, which makes it the leading cause of death in the United States. So it's a pretty big deal. So if you don't have it or won't get it, you're going to know somebody who will. So next, let's take a look at the causes of death in coronary artery disease. We have blood clots, lethal arrhythmias, and heart failure. So blood clots get lodged in those blood vessels that are full of plaque, and they ultimately stop blood flow down to whatever portion of the heart that vessel is supplying blood to. And when that happens, that portion of the heart dies. When that portion of the heart dies, it stops working appropriately and eventually fails. The lethal arrhythmias we're talking about are ventricular tachycardia or ventricular fibrillation. In both of those arrhythmias, the heart is not pumping the way it needs to, so it doesn't perfuse the body the way it needs to and get oxygen to the rest of the tissues and organs that need it, and everything shuts down and eventually stops. In heart failure, the heart gets weaker over time and can't pump blood that has been oxygenated by the lungs out to the rest of the body the way it should. And when that happens, the rest of our organs and tissues don't get the oxygen that they need and they start to fail. So overall, it is a systemic issue. So those are some pretty scary things. But there are certain things that put us at risk for having coronary artery disease. And those things are known as modifiable, which are things we can change, or non-modifiable, which are things we cannot change. So let's take a look at the modifiable things first. Those things include blood pressure, having high blood pressure, smoking, having a diet high in trans or saturated fat, so I think of a lot of fast food in that instance, being obese, having a lot of unrelieved stress, having cholesterol that is too high, like your LDL, and maybe your HDL is too low, the good cholesterol that you need in your system. Having too little physical activity, excessive alcohol use, and diabetes. Some things that are not modifiable or things you can't change are age. We all get older, we can't prevent it. Family history. So if one of your parents has it or a sibling, chances of you having coronary artery disease goes up. Income. Those with a lower socioeconomic status tend to have a higher risk of coronary artery disease because they don't receive the preventative care they need to prevent it from happening. And those who are male tend to have a higher risk factor for having coronary artery disease. However, women's risk goes up after menopause. Also, those living in the South, as you can see on my little map here in the risk factor area, those living in the South here in the dark red show us that they have a higher risk of coronary artery disease. Now, I live in the South and there is a lot of fried food and fried chicken, so it's almost not surprising. So now that we know our risks, let's take a look at some of the symptoms someone might experience if they have coronary artery disease. Shockingly enough, sometimes you don't have any. You don't even know that you have it until a major event happens. That's kind of scary. Some might have arrhythmias or feel a fluttering in their chest. Heart failure, even though it is a cause of death, is also a symptom of having coronary artery disease. A person might experience shortness of breath, some fatigue, swelling in the feet, ankles, legs, abdomen, and in the neck veins. A heart attack may be a sign that somebody has coronary artery disease or stroke. So since heart attack can be a symptom of coronary artery disease, and we know it is a major event that happens to a person, we also need to know the signs and symptoms for a heart attack so we can prevent it and help those who are experiencing one. So men and women both have similar signs and symptoms, which would include chest pain or discomfort, often described as a pressure or feeling of an elephant on the chest, shortness of breath, or pain and discomfort in the left side of the jaw, shoulder, neck, or arm. Now, women also have their own signs that are pretty unique to them. They might feel unusually tired, they might feel nauseous or lightheaded. And those might be the only symptoms. They might never experience chest pain, and maybe their only symptom is nausea. And so we have to pay attention to those little symptoms. So now that we know the symptoms, how are we going to treat it? Well, treatment for coronary artery disease includes quite a few things. One of them, then the first priority would be lifestyle changes. Because we do have some control of preventing coronary artery disease, we have to take those steps. So those include increasing exercise, having a healthier diet, limiting alcohol, and stopping smoking. Sometimes a valve in the heart might be dysfunctioning, so they might have to repair it or replace it so it functions properly. Pacemakers. So when the right atrium is not perfused or not getting enough oxygen or blood flow to it because of coronary artery disease, this could affect the way that our SA node or our natural pacemaker in our heart fires, slowing down our heart and rhythm, and pacemakers pick that speed back up to a normal rate of 60 to 100. Sometimes we might have holes in our heart, which sounds a little silly, but there can be a hole between the atrium or the two upper chambers of the heart, or a hole in the ventricles, between the ventricles, or the lower two chambers of the heart. And they need to be patched so that blood flows appropriately through the heart. They might do a balloon angioplasty, which is a really fancy way of saying that a doctor's going to go into those blood vessels, open up those blood vessels where the plaque have closed, and put in a hollow tube to keep those vessels open to restore blood flow to the heart. But sometimes, even if they try that, it might not work. Then they might resort to a coronary artery bypass graft, which means if that vessel is so occluded by that plaque they cannot open it up, they're going to have to go around it to make sure that portion of the heart gets the blood flow it needs. Transplants. If the heart is that sick and that diseased, the only thing that may fix it is a new one. And those who are really sick with coronary artery disease may not be able to wait for a transplant, and they might receive an artificial or mechanical heart. Those are some pretty big interventions. So now we're going to talk about the complications from coronary artery disease. Chest pain. Chest pain can stop any and all activity. It can prevent your activities of daily living. It is definitely a complication of coronary artery disease. Heart attack. While we know it is a symptom, it is also a complication because a person can end up losing their life from a heart attack or becoming incapacitated from it. It is a complication. Heart failure also is a cause of death and a symptom, but it is a complication from having coronary artery disease as well. Arrhythmias, like we just discussed, having that fluttering in the chest, and early death. The good news with all this bad news is that we can prevent coronary artery disease and those modifiable risk factors that we talked about. And the first thing we can do is help control our blood pressure. We want to have a good blood pressure of around 120/80. That is the goal. The higher the blood pressure, the more effect it's going to have on the vessels, and the less we're going to be able to have good perfusion or good oxygenation to the rest of our tissues. Having a Mediterranean diet and following that, which includes high in fruits, vegetables, seafood, lean meats, and minimal sweets. Exercise, increasing that exercise is super important, and it doesn't have to be going to the gym every day or running every day. It's moderate exercise for 150 minutes a week. So that's 30 minutes for 5 days a week, which looks like getting the heart rate up, increasing your work of breathing, but still being able to speak during that activity. Stopping smoking. Smoking unfortunately damages our blood vessels. So as long as someone smokes, they're going to continue to be at risk for coronary artery disease. Glucose control. Diabetics have problems with poor perfusion because their blood is a lot thicker and the sugar is a little higher. So we need to get blood glucose under control to help have better perfusion throughout the body. Stress reduction. Those who have high stress that is unrelieved typically increases blood pressure and also increases cortisol levels, which ultimately have an effect on our blood vessels, which can damage them. And then taking prescribed medications. So if you go to your annual PCP visit for your wellness exams, you might be on some medications that include aspirins, which help prevent platelets from sticking together, so it prevents blood clots. We have metoprolols or beta blockers is what they're called. Anything with an olol helps regulate our rhythm. You want to take those. ACE inhibitors that end in pril, so an example might be lisinopril, help with blood pressure, and statins, which help reduce cholesterol. So you might have atorvastatin. Those 4 medications are super important to take regularly and not stop unless directed by a doctor. These will help with preventing and treating coronary artery disease. So with all of this, what can you do as an individual? Well, I think the big thing is to recognize some of these symptoms that someone would have. And the biggest one is the symptoms of a heart attack. And you don't have to be BLS certified or ACLS certified to save a life. And I think that's the most important thing to take away from this. You just have to be able to recognize symptoms and follow 2 steps, which is call 911 and do hands-only CPR to a rate of 100 to 120 beats per minute. And that sounds a lot like the Bee Gees song, Staying Alive, which goes, ah, 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 staying alive. If you have that song in your head and you're compressing someone's chest who has fallen victim to a heart attack, you're going to give them good perfusion and you might potentially help save their life. And while that's going on, if there is another person around you while you're doing CPR, while you're doing those compressions, ask to see if they can locate an AED. And if they can, and if there is one available, have them bring it to you, open it up, and follow the prompts. Time is muscle. So the more interventions we do to help save that muscle, the faster we do it, the chances are better for survival. And if you have more questions about helping somebody who has fallen victim to a heart attack, you can contact the AHA hotline at 1-877-AHA-4CPR. I hope that this has all been very beneficial to you all and you've learned something. And hopefully you and I can both prevent coronary artery disease in other people. Thank you.